Hello and welcome to DirectCare. Thank you for joining the webinar. I'm Sammy Smith. I'm a part of the DirectCare team for a number of years, and we plan to have an informal discussion with some information, of course, to share with you. We'll go slowly and roll out this DirectCare concept to you. And at any time during our discussion, you are welcome to send in a question or comment. It will be private, that only our host will be able to read. The host can share with us. So, again, welcome. We're so glad you're here. Let me say hello to Dr. Hillary Morgan, who is an internal medicine practitioner here at the diagnostic clinic, and she is what I call homegrown. So, Dr. Morgan, tell me why I think you're homegrown.
Okay. Well, so many of you know, but so I was born here in Gainesville and grew up here. Went to West Hall High School. And then after that over to the University of Georgia for my undergrad, and then to the Medical College of Georgia in Augusta for my medical school, and then up to Charlotte for my residency training. Actually, same place that Jeff trained. So,
and you have been a part of the diagnostic clinic since 2010.
That's correct. Came back home in 2010. So finished residency in 2006, and my husband and I were in practice with a group in Charlotte for several years, and then when our second kid came along, decided we needed to get closer to home and closer to family, and so we moved back here in 2010.
Very good. In 2010, you met Dr. Jeff Terry, who was already here, established at the diagnostic clinic, and so that I am assuming was your first experience, your first knowledge of what he created called DirectCare.
Correct.
When you first came here.
Right.
Doctor, give us a thumbnail definition of concierge practice, which is what it's called, and how you got to create DirectCare.
Well, I got here in '99. I was a few years earlier than Hillary. Just a few years old. So, but when I came here in '99, I practiced traditional internal medicine for about 7 or 8 years. But at the end of the day, I kind of felt like that I wasn't able to give the type of care to my patients I wanted to give to them. I had a nurse practitioner, I had a PA. I was seeing my own volume of patients, and at the end of the day, I was responsible for a lot of patients, but I really didn't go to medical school and residency to really practice volume-based medicine, which is what it really felt like. And I didn't really feel like I was able to give that personal touch that I really wanted to give to my patients. And so in 2006, I started looking around and found a concept called concierge medicine. Then in 2008, kind of moved into that with the assistance of the diagnostic clinic to help build that practice. And I guess, to answer Sammy's question, concierge medicine is something where it's not running people through a mill. It's not a volume-based thing. It's where we kind of say, hey, you matter, where we kind of say that, I know you, I know my patients like the back of my hand. Somebody calls me up, they have my cell phone, and they call me up, I know exactly who it is, I know their medical problems, and so I can really speak to somebody with knowledge about what's going on with their history. So they can call me on my cell phone 24/7, they have access to me. I still do my own hospital work, whereas a lot of doctors don't do that anymore, turn it over to a hospitalist. And not that hospitalists are bad doctors, but a lot of times having that personal knowledge of somebody within the hospital is huge. It allows you to do better overall care for somebody. Focusing more on wellness rather than just when you get sick, you come see me. So trying to really focus on those types of things. And separate check-in, separate check-out, separate waiting area. There's a lot of benefits that we have that you can't get through a traditional model of practicing internal medicine. So That's really kind of what we offer, and the reason that I made that change was so that I could practice the type of medicine that I think people want, that they want to have that personal touch where their physician knows them, where you're seeing the physician and not seeing somebody else and may not have the same knowledge and that same intimate connection with you that a concierge doctor would have.
Concierge, the word, is most often associated with a nice hotel where you go for specialty service.
Yeah.
It's a come here and I'll take care of you kind of person in a hotel.
Correct.
But it also applies to this type of medical practice. That let me say, I was with Dr. Terry when he created and rolled this program out, at first in Gainesville, and he did extensive studies and research, and we set up some focus groups and a rollout pattern to introduce this here to the diagnostic clinic and to the community. I remember well the late Dr. Henry Jennings was with us in a focus group, and at the end of your presentation, Dr. Jennings says to you, "You're about to practice old-fashioned medicine." And that stuck. You've used that in some advertising and marketing materials for DirectCare, but it's the truth. It is actually old-fashioned medicine.
It sure is, it is. You can look at our banner back here. It says modern medicine, old-fashioned care, and that's really what we're trying to do, where the physician knows you. You're not just a number to the physician, where the physician actually has, as I've said, an intimate knowledge of you and knows your medical history. And in my mind, through my experience, and I think Hillary would say this, a better overall knowledge of a patient allows for better overall care, and that's really what we're looking to offer, is that through a DirectCare model.
Dr. Morgan's association here, professional association with Dr. Terry and the all of the staff here at the diagnostic clinic, gave you really an introduction to this specialty practice. Tell me what was it that attracted you to this kind of practice for yourself?
Well, a lot of the same things that Jeff talked about. The current setup with sort of traditional medical practice these days that you see a patient every 15 minutes or so, back to back with no breaks, which really just doesn't allow the time to focus on all the patient's needs and to provide the best care. And I do think that continuity of care is really important. Jeff actually took care of my grandmother for quite a little while, and it just was a huge blessing to us to know that she was going to have the same care in the hospital that she was going to have as an outpatient, and her doctor in the hospital was going to know everything about her, even if she couldn't fully give all the history, and to know that things were going to be carried on from one place to the other. And it really did make for just excellent care. So that was sort of my first introduction to that model of care and seeing it up close. And then over the past several years, I've been helping cover Dr. Terry's practice when he's out of town and things like that. So I've gotten to know how the model works and a lot of his patients, and just really been impressed with how happy they are with their care, and how easy it is with that type of model to be able to address things as they come up, rather than waiting till things get down the road and can get out of hand and things can get worse. But one of the things that we're able to do is see people on a same day basis, and so we're able to get people in right away and get things addressed that hopefully keep them from getting sicker and ending up needing hospital care or things more serious. But so that aspect, I think, is really important as well.
The DirectCare model, the program, is a fee-based program based on a calendar year fee, which is part of the literature that you all have received, and you are invited to join or consider joining based on a calendar year fee or a prorated fee on a part of a calendar year, be it April 1st or July 1st or something. The fee is a part of the service, a part of the access that these physicians are providing. I will say from personal experience and conversations I've had, it's not out of reach based on what you get. So is there anything you can add to the fee-based?
Sure. Yeah, in order to do a concierge practice, we have to have that outside fee. There's no way that we could do what we would do based off of what you would get from traditional insurance, traditional Medicare, Medicaid, things like that. And so I do think it's something, in order for us to be able to give the level of care that we do, in order to support the staff that we do have to require that outside fee to allow that to happen. But I think, as Sammy has said, Sammy's a patient of mine, and I think he's realized the benefits of actually having that availability. And so a lot of people do say, man, this is money well spent. I've had people say, I don't think I've spent better money in my life than going through and being part of this program. So again, it is a fee that's there, but I do think that a lot of people do say this is definitely money well spent in order to be part of this program.
Let's address just briefly, I want to brag on your staff because they're always friendly and welcoming and accommodating, always. I don't know your staff, but I assume and hope that you would think the same of them.
I think so, yes. So at this point we've added one nurse, Kim, who will be working with me, and Dr. Terry's nurses will help us out a little bit, and we'll quickly add, I think, a second staff person to work along with Kim. But she has a super fantastic personality, super sweet, and very, very sharp, and I think will do a really great job.
There is comfort from a telephone call if you know your prescription's going to get through, or he's going to authorize a refill, or if you for one reason or another need to see Dr. Terry during the day without an appointment or something, that you're just going to get taken care of, and that offers great comfort. Yeah,
absolutely. And I think that access, I think, is key. And I know from working with Jeff's nurses over the years when I've been covering his practice, they do a lot of work. I mean, they do a lot of phone calls. They do a lot of patient education. They really have, like us, we have more time to spend with the patients, but the nursing staff also has more time to spend with the patients. So they really do go above and beyond and give just excellent service. And I think one of the other important things to mention is that when you call, you go directly to the nurses. So when you call DirectCare as a DirectCare member, you go straight to those nurses who know you and know what's going on with you. And so we don't utilize the customer service message taking, and we have our own dedicated staff that are on the other end of the phone when you actually call, and can answer a lot of those questions quickly. So that gets rid of a lot of the delays that we have with things like refills and just trouble getting through on the phones when things are busy and that sort of thing. So a lot of things can be taken care of quickly and conveniently.
Let me mention again to all, if you can read this, is a email address for any comments or questions. It says directcare@ngdc.com, and Dr. Morgan, Dr. Terry welcome your questions or your comments, and can appropriately respond whenever they can, but your comments or your questions are very welcome to this website. Dr. Terry, at some point you got comfortable in your DirectCare practice, but it was not early.
What do you mean by that?
Because I was with you.
So, because you were with me, but you're still with me.
Because I know that. Your numbers.
Yes, gotcha.
Your numbers.
Yeah.
Your enrollees, your patient numbers. Tell us.
Yeah. So I had a traditional
Because
practice.
I'm sorry,
Yeah.
because this may or may not now be a precursor to your startup.
Right.
Yeah.
So
Okay. So when I actually switched over from traditional internal medicine over to the concierge practice, opened it up to my practice, my patients that were part of my practice initially, and had a good response from that. But it took a little while, in order to get to the numbers where I am right now, to get to the point where my practice is full. It did take a few years to do that. If I don't know if you guys were in Gainesville or not, I ended up doing some radio spots on WDUN, which is actually a lot of fun. I enjoyed doing that. That was fun. But that actually helped getting the name out there, getting the word out there, and continuing to grow the practice. Until really within about 2 years, I got to the point to where I had a good nucleus of patients to really have a developed and mature practice. What's happened since that time is I've continued to grow, but because of the size of the practice and not wanting to get to the point where I get to be too big, where I can't offer the services to the patients that are part of the practice, we've established a waiting list, and that waiting list has actually grown pretty substantially over the 8 to 10 years. And I'll pull people off the waiting list as I can, but there is still a pretty substantial waiting list of patients. And again, what we're looking to do is allow Hillary's patients and people that have knowledge of Hillary be able to kind of come in and join the practice. But at some point, we'll open up my waiting list and kind of say, hey, I can't take you, but we do have Hillary Morgan, who's moving into a concierge practice as well. And so, hey, here she is, to be able to kind of deliver the same type of quality of care that I do to patients with her practice. So truly excited about that patients that are on my waiting list will be able to kind of get into a concierge type model.
and let me clarify, Dr. Morgan knows this story. We're not surprising her with anything. And in my opinion, a 2-year cycle may be greatly reduced for you. The concept is known, his reputation is known, your reputation is known. You have a patient base already. Early practice for you means what?
Well, so I mean, we're actively enrolling, and I hope to keep a lot of my current patients with me. I have a lot of patients that have been with me since I came almost 11 years ago now. So I really hope that a lot of those folks will come. And we have opened it up at this point only to my patients, but we'll be reaching out to others on the wait list if space permits in the next little bit. So definitely hoping to to get a nice full practice as quick as we can, and get settled in and just start taking good care of people, or continue taking good care of people, but in smaller numbers. So.
In terms of familiarity for your patients,
Mm-hmm.
will you stay in the same practice location that you're in now?
So we will be here on the Gainesville campus, and so I think we're having some ongoing discussions about maybe a different space within the same campus, but at some point. But I think for right now, we'll be starting out in the exact same location.
It's comfortable for your patients.
Yes, correct.
They know where you are.
They do. But there will be a few differences. They will, as part of DirectCare, have a separate check-in area. So there's a separate check-in office up front. And so instead of checking in at the Pod B reception like you normally would, you will have a separate office and a nurse to check you in there, and they'll bring you back to the back. And the idea being with smaller patient numbers and fewer people during the day on the schedule, that we should be able to run on time and to get you back quickly. But we will have also a separate waiting area in the back, so that if there were a wait, or you need to wait on a test result, or you need to wait on an x-ray or something like that, we'll have a private separate waiting area back in my area where I am now. We'll have that set up so that with some snacks and coffee and that kind of thing to make you comfortable while you wait.
Your introduction mentions detailed medical procedures,
Yes.
which will become a standard part for you you've said time and attention.
Mm-hmm.
Can you explain or run through those details?
Right. So, so we still will do your yearly physical, like most of my patients are used to doing with me. But we do add on some additional services. So we add on some additional screening tests. We add on some additional x-rays. We add on some hearing and vision screens, spirometry, which is some lung testing to get an idea of your lung function, and a few additional lab tests, just to give a few more bits of information and to give more well-rounded picture. And those are some things that is not necessarily always covered with your routine physicals through your insurance, but those are some things that we add on to the yearly physical. And then of course we'll still see you periodically, depending on what your health needs are throughout the year, for follow-up visits.
Sure. Was this a list of ads that you
Yes.
created?
Yeah, so Hillary's kind of building her practice off of what I'm doing already, and yeah, so there's no doubt that I can tell you my focus. I take care of sick people, but I love my focus to be on wellness. Again, I want people to be well. I want them to realize that there are things you can do to make sure that you're doing the right things, whether that be diet, whether that be exercise, other types of things that we can do that we can talk to you about to keep you from getting sick. And again, like I said, I'll take care of you when you're sick, but I'd love for my focus to be on wellness. And I think that's what Hillary's saying as well, is that, again, we want you to be well, we want you to live the happiest, best life that you can. And so that's going to be our goal, is those wellness examinations. Spend a lot of time with those things to make sure we can make sure you're as well as you can be.
Hospital privileges sometimes can be of concern to the patient, and there's some outside impacts with insurance and other things, but can both of you just explain your hospital privileges?
Mm-hmm. You want to get?
Sure. We will provide inpatient services. We don't go to every hospital, but we will provide inpatient services here at the main campus at Northeast Georgia here in Gainesville. That's it for right now. I mean, I think that will continue to be our focus. So if you are sick, if you need to go to the hospital, that's important to know that would be your hospital of choice.
And I've been doing this for a while, and so what happens if you go to the emergency room? We have the emergency room doctors evaluate you there, and so it's kind of like if you go to the emergency room, we don't come in initially at that point, but the emergency room doctor will take a look at you and kind of say, hey, this person needs to be admitted. That's when we get involved. We don't want to get in the emergency room doctor's way. We want them to be able to kind of do the evaluation they need to do. But it does turn out that when they say you can go home, you go home. They'll call and let us know that. But if you need to be admitted, that's when Hillary and I would get involved, getting you admitted to the hospital, making sure that you're well taken care of, make sure we're getting the right subspecialist on board. Another thing that I'm always real proud of with the DirectCare model is that, we kind of know the doctors real well, and so we kind of know, if it was my mom or my dad, or if it was my wife, who would I want that person to see. And so we are able to kind of pick and choose a lot of times our doctors that we want to be able to take care of them, not only as an inpatient but as an outpatient as well. And so I think that's something that we're able to offer that other people can't offer, because we do have that relationship with other doctors who can really kind of help us out and feel like we're giving the best level of care, the best physicians in town to take care of you.
What's the best part of DirectCare?
Best thing, I think for me, is really the family feel. I tell you, I still to this day kind of talk about that. I mean, we kind of say it's a big family, and there's no doubt. I mean, when people talk to my staff, they call up, and just a lot of times people just call up sometimes and say, hey, and that happens. And there's a true family feel there, that once you become a member of DirectCare, you become a family member. And again, you are treated like that. We want you to feel like you're part of a big family, and that's what we want to do, is kind of have that relationship where you just feel comfortable coming in and being able to be part of a relationship that we have with our patients.
And what does that promise for you?
Well, so I think, I agree. I mean, I think the relationships with patients, and particularly, you have a lot of families where I see multiple family members, and that's one of my favorite things. I mean, I really like seeing multiple family members, husbands, wives, adult children, sometimes parents of adult children, and I really like to know the whole family and the whole family story, and so I look forward to that, and I look forward to just having more time to spend with my patients to get to know more of the things that make you tick, and the more of the things that are going on the personal side of things, which really can affect your physical health. And so, there are a lot of things that I think play into somebody's health overall, and those are things that we have more time to spend and more time to address.
In the subject of family, large family, you're the patriarch of the Direct Care family.
A lot of kids.
And we and you and your children enjoy a barbecue.
We do, that's right.
Every year. It's free, as it is. Fun, social, no program. A few folks are there that we can interact with, but it's mostly just social and fun.
Yeah, it is. We had to cancel this last year because of COVID, but we're really looking, and I don't know if we'll be able to do it again this year, still kind of up in the air. But once we kind of get done with the COVID things, I'm hoping that we can kind of get back and start doing this all over again. But it really is. A lot of times we go to Walter's Bar and go out there, and we just have Johnny's bringing barbecue, and just a kind of a time to kind of sit together. It's nice to see people when you're not sick. It's nice to be able to kind of get together and just socialize and enjoy seeing the patients, in a different environment. So it really is a lot of fun. We have a good time doing it, and it'll be good to kind of add Hillary and her practice in there as well.
It
sure is. It is, yeah.
Good time to introduce her to a cross section. Your current patients, and they'll mix, and it's a very enjoyable time. Let me say again how much it is easy and a pleasure to interact with your staff, and I hope that is a lead-in for your staff as well.
Absolutely. Well, she's being trained by Jeff's excellent staff, as we speak. So, and I guess back on that, sort of idea of family and what happened, how do things work? Well, I mean, eventually, I'm going to take a vacation from time to time. Things are going to happen. I'm going to be out of the office. So the other important thing to know, and one of the reasons I wanted everybody to see Jeff and get to know him a little bit is that if I'm gone, Jeff will be taking care of you. So it won't be, won't be the hospitalist service. It won't be another provider from within the clinic. It'll be Jeff will be taking care of you. So he'll know several of you, just like I know several of his patients now from having covered when he's gone. And that's so you'll know exactly who's going to be on the other end of the phone when you call. So.
Okay, we're getting close to wrap up. Again, we would like for to receive your questions or comments at this email here. It's private. Don't feel inhibited, but your questions or comments are welcomed. And should they require a response, then one of these physicians or their staff can respond and will respond if it does require it. You have, all of you, I believe, attuned to the webinar, have basic information that you received in the mail, which describes in great detail the program and the fee and the purpose, what your fee covers. Again, it's a calendar year fee, which can be prorated based on your months of membership. So we invite you to take a serious look at this specialty practice. We're very proud that it's growing. Nice compliment to this fella and a nice compliment to you as well. We look very much forward to the practice growing and flourishing. Closing for whoever is watching.
I'll go first. Again, I'm extremely pleased to have Hillary coming on board. She's done a wonderful job with caring for my patients when I'm out of town. As we're talking about, we'll do the cross coverage. But before she's actually come on, she's actually covered my practice, and she does a fantastic job. My patients love her, and I have no doubt that she's going to do extremely well in this model, be dedicated to the patients the way that I feel like I have been, and I think she'll be kind of having that same focus on excellence of care, focus on wellness, taking great care of her patients, whether they're in great shape or really sick. I have no doubt that she'll do a wonderful job of doing that. So again, I think in closing, I'm just very happy to have her on board, and looking forward to her being able to grow her practice and really join the direct care concept and just do an excellent job with it.
And I just thank everybody for coming. I think looking at the list ahead of time, I think I know most of you, and I'm really excited that you're thinking about it, and really excited that you're considering coming on board with us, and happy to answer any questions. If you want to send an email to the DirectCare email, I'll be glad to get back with you. Be glad to talk to you on the phone if you have more in-depth questions. So just let us know what you're thinking, and the girls, if you decide to come along and sign up with us, the nurses will be more than happy to get you signed up and take good care of you.
From the growing direct care team, thank you for today. Pass this message on to others, if you will. We will rebroadcast this in about a week so others can watch and listen. Thank you. Be safe. Stay well. Thank you.
Thank you.
Thank you.